Patients going through chemotherapy may experience a variety of side effects. Each chemotherapy medication is different. Some patients get nausea and vomit. Often this can be controlled with anti-nausea medication. If you need medication to prevent nausea, do make sure that you start taking it before the nausea starts, and do follow your doctor's instructions. Be sure to observe proper dietary habits too. Here are a few dietary suggestions to follow through. Eat before cancer treatment. Dry food like crackers or toasted bread are sometimes better tolerated. Slowly sip on fluids throughout the day. Sit up or lie with your upper body raised for at least half an hour after eating. Find your own form of distraction such as watching TV, and most importantly, seek medical attention immediately if vomiting persists or if you are unable to consume any food or drinks. It is good to eat small frequent meals as and when you wish throughout the day. Make every bite count with nutritious sandwiches, granola bars, milk, malted drink, biscuits and fruits. And make sure that you always have some form of packed snacks with you at all times. When it comes to mouth sores, it's important to use alcohol-free mouthwash. Always use prescribed medications to help ulcers heal, and you should always consume soft pureed food to decrease chewing. Soft food or meals such as rice, noodle soup or porridge are encouraged. Avoid any kinds of citrus and tomato-based products as they tend to irritate. Avoid rough or coarse food such as crackers, toast and raw vegetables. Avoid food that are spicy, salty and sour such as tom yum soup or curry. And please seek medical attention if you have painful mouth ulcers that bleed. Prolonged loss of appetite must also be brought to the attention of your medical team. For dry mouth, eat moist food with extra sauces or gravies. It is also good to keep water by your side at all times to moisten your mouth. Oral moisturizing gel can also be used to help you cope with the situation. Avoid sweet, sugary and fizzy drinks as they will make you feel thirstier after consuming. Here are some dietary suggestions if you experience any changes with your taste buds. Rinse mouth with water before eating. Try citrus fruits such as oranges, tangerines, lemons unless mouth sores are present. If the meat tastes bitter, try substituting with eggs, chicken, fish or dairy products. Try vegetarian sources of protein such as tofu, beans and other bean products. Consume your meat with a sweet sauce such as cranberry sauce, jelly, applesauce or any other sweet and sour alternatives. Switch to plastic utensils if the food tastes metallic. Dried fruits can be consumed to aid your situation. Your doctor may recommend medications to prevent or treat constipation. You may also try dietary solutions to manage the side effect. It is good to increase your amount of fiber. Fiber can be found in any fruits, vegetables, and whole grains. Drink at least 8 to 10 glasses of fluids every day. Introduce some physical activity to your lifestyle. But more importantly, seek medical attention if constipation persists for more than 3 days. For diarrhea problems, always take broth, soup, electrolyte drinks, canned fruits and bananas to replenish the salt and potassium lost during the process. Drink plenty of fluids throughout the day to keep yourself well hydrated. Avoid vegetables such as broccoli, cauliflower and cabbage, as these tend to make you feel bloated and increase flatulence. And seek medical attention if your diarrhea exceeds 5 times. Severe abdominal pain and high fever of 38 degrees must be brought to medical attention too. Prescribed anti-diarrhea medications must be taken, apart from following dietary advice. Not all chemotherapy causes hair loss. However, if you have this problem on hand, keep these suggestions in mind. Observe scalp care by using mild shampoo. Use water that is not of extreme temperature. Use wigs, scarves or hats to maintain and improve image. Use cold cap to freeze hair follicles to reduce hair loss. However, take note that not everybody benefits from this. No coloring or perming of hair during chemotherapy. More importantly, it is crucial to understand that any loss of hair is only temporary. It is highly likely that your hair will regrow after you're done with the treatment. Those dealing with low white blood cells count are at greater risk of getting infections. Here are some signs and symptoms you must look out for. Fever of 38 degrees Celsius or higher, sore throat, pain when passing urine, chills and shivering, cough with shortness of breath, diarrhea. If any of these signs are present, please seek medical attention immediately. To prevent these from happening, you may need to receive a booster injection from your doctor to sustain the white cell count level. Practice good hygiene. Avoid direct contact with pets and soil. Avoid crowded areas. Stay away from people who are unwell, such as having a cold or chicken pox. Do not introduce foreign objects into body cavities, such as a suppository or rectal thermometer. For those with low platelets, you are at a higher risk of bleeding until the platelet count recovers. Look out for bleeding gums, blood in urine or stools, or very heavy menstruation. Always remember to use soft toothbrushes and do not floss your teeth. Prevent constipation so you do not need to strain. Your doctor may recommend a platelet transfusion if platelet count is critically low. For those with low hemoglobin, you should take note of shortness of breath, giddiness, headaches, and just being tired in general. Iron-rich food such as red meat, liver, soy products, spinach, iron-fortified bread and cereals may help. Your doctor may prescribe medications or blood transfusions to help too. For low white blood cells, platelet and hemoglobin, the counts are expected to recover. During treatment, you must seek immediate help if you were to experience any of these signs. Fever of 38 degrees Celsius or higher. Unrelieved severe nausea and vomiting. Unusual bleeding, unresolved severe pain, shortness of breath, unresolved diarrhea with a frequency of more than 5 times per day, constipation that lasts for more than 3 days, confusion and mental disorientation, painful mouth sores, rashes or hand-foot syndrome, insomnia and depression.